technique I'm going to show you is vibration. Anybody know already what the difference is between vibration and rubbing? No. You sure? Because we did it on your legs. So think a bit. Do you know what rubbing is?
Isn't rubbing,
yeah, so the clue is in listening. Keep going, folks. Okay, so rubbing rubs across skin, across clothes, and you can hear that, okay? You can hear that rubbing, okay? The difference is that with vibration, what you're actually going to do is place your hand on and actually engage more with the tissues. So allow your hand to sink into the tissues and vibrate the tissues. Vibrate the tissues. What do you think this is really useful for? Any ideas?
Circulation.
Yeah, so it'll increase the circulation in the area. Any other ideas you got?
Stimulating the muscle?
Yeah, it kind of stimulates the muscle, doesn't it? There's a stimulation of the tissues.
Loosening up adhesions.
You think it might be really good for loosening?
Yeah.
Yeah. We're going to ask Callum in a minute.
I do it after I press on the knots.
Ah, that's useful. Did I tell you to do that?
Yeah.
Yeah. Okay, so so when you have, you know, like when you've done something quite intense and deep, so you're doing a little bit of compression work maybe somewhere, then I use that vibration technique as a just to help the body just accept that work. It's a bit like rubbing something when it's sore, but it's not rubbing, it's vibration. Now you'll see that I use my whole hand, yes, and then I've actually gone on to using the heel of my hand. Have I not? So I'm using the heel of the hand much more specifically into an area. Now I'm going to actually, so I can go along fibres, across fibres, however I want to do that. So I can vibrate the whole of him, more like this, or I can be very specific. I can also use fingertips. It's not a technique that you want to be doing for ages because actually you have to kind of keep tense in order to do this. I'm just going to move his arm down to the side to open up that space. Do you understand what I'm doing there?
Yeah.
Okay. So it just means that I can get in that medial border. Now I've got a lovely bit there, haven't I, Callum? Haven't I got a lovely bit there? So here's an area I'm feeling here. I don't know whether the camera can pick up as I go over. That's an area. Come closer, everyone. You won't see it from there. So there's an area. Can you see that I'm going over? Well, quite likely there's some sort of trigger point in there. So I could go in to do trigger point work compression. There's probably some area of tissue that's quite tender and tight in there. So I could do some compression. I have to watch my language, don't I? But I could equally decide to try some vibration in there and see if it works. And you'll see me moving this as well, because we're going to do that in a little while too. Okay? So let's just find out from... So I might do a bigger vibration in there. I might do a smaller area. I might use my knuckles. I'll use my knuckles a lot. It's quite useful.
How strong or deep?
Yeah, well, that's an interesting one. So how strong or deep? If I'm doing a large area, I could do that quite superficially, couldn't I? Yeah. If I'm going in to work more deeply, again, it's the stiletto, and that's almost like a cross friction now. But there's a vibration. So if I'm going in with fingers, then it's a much more intense, deeper technique. I want to show you how it might transfer in other areas. So I use vibration a lot in areas like the buttocks, and there's using my knuckles. I could equally use the heel of my hand. How are you doing down there, Callum?
All good.
You like?
Yeah.
Tell me what the effect is up here where I did it more intensely.
It just feels a lot looser. Just It's like when you shake your legs out after you've been
Yeah, it's
stretching. or something,
really
yeah.
like when you shake your legs out. It really is like that, okay? So any way you like, you can do this. This is just another technique for you to try. Part of the vibration work for me is also picking up and shaking. You just said that, right? So what I will often do, it's a little difficult because his trouser material is silky. So that would be like having oil on his skin, okay? So I'm just going to go skin to skin. Don't want any oil. I don't want any oil here because I can't then grip. So what I might also do is pick up and literally shake. We did some of this, didn't we? Yeah? I might pick up and shake. That's almost going into a sort of oscillation technique as well. I might pick up and shake. And I might shake a lot. What do you think, Helen?
Lovely.
Yeah. So what's the overall effect on you?
It's quite relaxing, really.
Yeah, so in some ways, so if at the end of a treatment, I might just do a little bit of vibration. It's a bit like the percussion. I might do a little bit of vibration to wake them up. Yeah, that would be a little bit waking up. Or I might use it much more specifically in an area. Or I might use it to really relax somebody. Okay? So if you imagine doing some of this for long enough, it can be very relaxing, particularly if I slow it down.
It's more like it feels like a rocking sensation.
Yeah, we're going on to rocking.
Okay.
So a lot of these techniques, I'm finding it very difficult not to do two at the same time, because that's my thing, that's what I do. I usually combine 2 or 3 techniques at the same time. So I'm trying really, really hard to keep this simple for you. So there's the technique. Whole hand, heel of hand. Heel of hand's quite useful, particularly in the medial scapular border. And just notice I move the arm just to get more access in there, okay? And I might move it back if I want more access up here. Okay. But if I want to make that area easier to vibrate, I might move the shoulder up. These are all things that you've learned. And you can see how easy it is to combine a few different techniques with a clothed massage, right? You know, it's not difficult and it feels good. Does that give you enough to just have a little go with the vibration? I'm just wondering whether I need... Let's do a bit of rocking. Let's do a little bit of... I'll explain the different techniques as well, and then we'll cut it into bite-sized bits. So, oscillation. Any idea what oscillation might be? Do you know what it means?
Rounded movement.
Movement. It definitely means movement, doesn't it? What you're actually going to do with oscillation and with rocking, they're almost interchangeable, but they can be used in slightly different ways. What you're actually going to do is use the client's body to maintain and improve and encourage that movement, okay? It can be very useful as an assessment as well. So one of the easiest, quickest ways to learn a little bit of rocking is to literally move the hips from side to side. Now, if I just use this hand, can you see that I'm actually allowing his body to what? Come back. What's another word for that? Return or rebound. Okay? So all I'm doing is providing the push from here and watching what his body does. Then, if I use a hand either side, I can actually encourage that movement. I don't have to use it either side. Okay? I can actually leave it with one or the other. But the trick, the real trick, is being sensitive enough to what's happening here, so I use the minimum amount of encouragement necessary. And then what I can do, and it's his rhythm. This is Callum's rhythm. This is not my rhythm. I'm watching his rhythm and working with that. What I might choose to do is change his rhythm. And I might use the sacrum as an area to get that moving. Okay? So the easiest place to sense that movement is in the hips. Why do you think that might be?
It's your center of the body.
So it's quite a central, balance point. Actually, it's kind of more in the hara, but this area, the lumbar spine, actually moves very well, doesn't it? You've got full rotation there. And what do you think would happen if I moved to the ribs? Do you think that'd move as well? Why do you think that might not move as well, Claire?
The ribs are closer together, so the muscles are shorter.
So the ribs actually create a more stable structure, don't they? They're there for protection. So look what happens when I move the ribs. Much less movement there. Yeah.
It keeps moving, the hips.
Really? You notice that? Yeah. I didn't mean that sarcastically. It's like, yeah, look. Look at how far you get movement from wherever you are. Now you see why it might be a good assessment tool. Why do you think that might be?
You can see where they're tense and they're holding.
Yeah, you can see often where their body flows more freely and when it's restricted. Okay? One of the easiest ways to get that movement is by using both hands, one side, and really get a sense of movement through the body. So the difference between oscillation and rocking is that very often we'll call the smaller movements oscillation and the bigger, grosser movements the rocking. Here there's no doubt I am rocking his whole body, okay?
Did you have anyone falling off the...
No. No. However, what I would say to you is different couches tolerate this better and worse than others. You'll find that each couch has a way it's not happy, and you'll kind of learn that as you work around the body with this movement. So I don't want to give you too much, but I want to show you just this plane of movement. So what I've done is started at the hips. Let's just go over it again. I can do one side, both sides. I can work at the chest area as well. I can do both and see what happens then. I can do either side. Hang on. And I'm also going to show you from this plane of movement how it works down the legs. Some of you, I kind of can't help but do this kind of thing when I start and finish a massage, okay? It's part of what I do. I want to show you what happens with the movement. There's other names for this kind of technique, by the way. In myofascial release, they call it rebounding. Why do you think that is? Because it rebounds, okay? There's another type of therapy called pulsing, which was born more out of psychotherapy. So that one is used much more for emotional release. And there's a lot more to that, and I'll show you some of that. And then the other thing is one of our MTI tutors, Darian Pritchard, he has developed what he calls rhythm mobility from this kind of basic oscillation rocking movement. But and what else is there? There's myofascial. I'll come back to you if there's another one, because I wrote it down. Tragering. Milton Trager is another guy who, and the guy who developed pulsing actually did so after he was watching a demonstration of the Trager approach, which is another kind of offshoot of massage that uses movement. Okay? This happens to be one of my favourite kinds of massage. Okay, so watch what happens when I get see how good his movement is, and look at the movement all the way up to his head. What happens when I get here? I lose it. Why is that?
Because you got the knee.
Yeah, because it's transferred through another joint. Okay? So in a sense, I just want you to get a feel for that. So one leg, you can work. What do you think that's like for the hip?
Be very good.
Yeah. You think it'd be good?
So that's the
Very
thing, is it this is the question I was going to ask. Is it beneficial for the joint? Because
I'm-
it helps
I'm
you
gonna-
to see the flexibility.
What do you think it does to the spine? Now I'm coming advancing this a bit, okay? But what do you think that might be like for the spine? It really helps the mobility. What do you think that's like for the chest cavity, the ribs? What do you think this might be like if somebody has, you know, some people get really stiff in their thoracic spine and they don't breathe very deeply, do they? What do you think this would be like?
So that's more beneficial for the bones than the muscle. Well,
For
you do move the muscle.
I would say both. So I'm going to show you another one because this is coming on to the erectors, and all I'm doing now is using that oscillation movement on the muscles. So is it good for the muscles or for the joints? It's good for the musculoskeletal system. Yeah? It's good for mobility. Now the other thing I would say to you is watch how nicely you can finish this. Watch his breathing. Did you see that?
Mm.
Yeah, good. All right, so you just kind of feel the movement to the end. So shall we ask Callum what that was like?
That nearly put me to sleep. Yeah, that was very.
And how does your body, just sit up for me and see how your body feels now?
It feels really light.
Light.
Light is probably the best word for it. Yeah.
I've used this a lot with, I've used this a lot with people like dancers. And you know, imagine if you've got a technique here, you've got this technique here where you're using their body to get them to move more easily. So it's effortless for the practitioner, really. It's very little effort for the practitioner, this kind of work. And imagine you've got those clients who are stiff as a board. You know the ones I mean? They're rigid. And you're trying as hard as you can to work into those muscles and you're actually getting nowhere. These techniques really do loosen where nothing else works. And those people who can't let go, you know, they really find it difficult to let go. They can't help but let go when you do this kind of thing because they can't resist you. It's like too much movement to resist that. It confuses them. It kind of allows their brains to switch off, which is, I think, why Callum said it was so relaxing. Your body, your mind switches off. It's a bit like being rocked. And it's a bit like bouncing a basketball as well. You know, you can bounce this basketball quite with large strokes, or you can get close to the ground and do a little dribble. And that's a bit more like the finer movements of the oscillation. What am I watching for? I'm watching for all of those responses that he had. The breathing really shifted at some point there. I'm looking for how his whole body responds to that movement. And then I might go in much more specifically to work on that area. Yeah? So there's a lot more to this. So I'd love us to kind of like, you know, really get to grips with the side, from standing from the side of the couch. Let's get to grips with that. And then we're going to actually take it and really develop it.
Sally,
Okay.
would you start a massage with this or end?
Both. And in between. And don't forget we did the vibration.
Yeah.
I don't ever stop moving people. So I use it at the beginning. I might use, for instance, I might use some of your holding and just feeling in there. Yeah, I'm feeling to feel what's going on. And then I'm rocking and feeling what's going on. Where it's tight, where it's moving, where it's not, what I need to do. And then I'm checking. When I'm checking, does that feel different now? And then at the end, imagine finishing with that lovely.
So would you do it instead of a hold? Would you do a hold as well to finish?
Yeah, I might. I don't know.
Doesn't matter.
Do you know what? I do different things every time I work. Okay? So it really depends on the person.
Yeah.
And of course you could wake somebody up with some of this stuff as well. You know? Works both ways. So, in your pairs, you don't need to undress.